Recent reports in global media about deaths and infections recorded on a cruise ship have prompted international health authorities to take urgent action. According to official information, the fatalities among passengers are linked to an outbreak of a rare epidemic known as hantavirus on board. It is noted that this is a dangerous group of viruses transmitted to humans through rodents. Experts say that high-risk environments include warehouses, basements, old buildings, agricultural facilities, and enclosed spaces such as ships. Certain strains of hantavirus have a relatively high mortality rate. In particular, forms that cause pulmonary syndrome can progress rapidly and lead to critical conditions in a short period of time. At present, there is no specific antiviral treatment for the virus. Doctors are mainly relying on intensive care methods aimed at supporting the patient's respiratory system. Early diagnosis is considered vital. The cruise ship linked to the deadly hantavirus outbreak is reported to have departed from Praia, the capital of Cape Verde, en route to the Canary Islands in Spain. It is estimated that around 150 passengers and crew members are on board. Health authorities have intensified emergency measures to prevent further spread of the disease.
This is not the next COVID, but it is a serious infectious disease. It's an infectious disease that if people get infected, and infections are uncommon, they can die. And so, again, people hearing this that are on the ship are, very rightly so scared. And the general public might be scared as well.
According to the World Health Organization, 2 individuals confirmed to be infected with hantavirus, along with a third suspected case, were evacuated from the cruise ship and transferred to the Netherlands for treatment. Reports indicate that the condition of the 2 confirmed patients remains critical. The third individual is not showing symptoms, but is believed to have had close contact with one of the passengers who died on board the vessel. European Union health authorities said on Thursday that they are closely monitoring the situation following suspected hantavirus cases recorded on the Dutch-flagged cruise ship Hondius. Concerns over the spread of the virus are increasing. However, experts currently assess the risk to the general public as low. Out of 8 reported infections, 5 have been confirmed through laboratory testing.
We follow the situation really very, very closely, and we try to very thoroughly assess every possible risk that would be potentially here for the citizens in Europe. According to the current situation, there is no cause for concerns at the moment. We are monitoring the situation very closely.
According to preliminary investigation findings, the source of the virus outbreak on the ship is believed to be a Dutch couple. It is reported that before boarding the vessel, they were exposed to the virus in southern Argentina after coming into contact with rodents in a waste disposal site. Authorities in Buenos Aires are now working to determine whether Argentina could be the origin of the hantavirus spread. Health authorities in both Europe and Africa are also trying to identify individuals who may have come into contact with passengers who had previously disembarked from the ship. Officials state that no symptoms have been observed among passengers and crew currently remaining on board, and they are being kept under isolation in their cabins. One of the passengers, Turkish YouTuber Rui Senet, said in a statement that no warning had been issued during the voyage regarding the spread of the disease. He emphasized that passengers were not informed about the real level of risk and that no special preventive measures were taken to stop possible transmission.
Then captain said one of the passengers sadly passed away, and it was due to natural causes. We're not we're not in infection. There's no contagious disease, something like that. So this was a relaxing explanation, but this was not the case because the first death was because of the hantavirus. And after this announcement, we were not ready or we were not isolated for what was to come.
New world hantaviruses cause a disease that we are seeing now called pulmonary syndromes. So the main targeted organ are the lungs, and it is believed also the heart to a lower extent. And the fatality rate is around 40%, which is why people are so scared, probably. And for old world antiviruses, though, the pathology is quite different. So they mainly affect kidneys And the fatality rate is much lower. It is between 1 to 15%.
Recent developments show that in an era of increasingly intensive global travel, viruses once considered local can quickly turn into international health threats. Cruise ships, ports, and densely populated enclosed environments are identified as particularly high-risk settings for the spread of infections. Experts warn that climate change, along with a growing rodent population, could lead to more frequent cases of hantavirus being recorded in the future.